All right, so we're gonna kind of bring back to a full group type of thing. So we wanted to come back and do a couple of take-home points with really, working through these as an experience being what we see as the biggest value to this. Um, I'm actually kind of a latecomer to the med-ed world through my residency, so there were a lot of aspects of these micro-teaching methods that I was using, not really knowing exactly what they were. But the thing that we want the most out of this is to expressly say these and to see what works, what doesn't. Did anybody have a favorite out of these methods, one that was new to them that they thought worked well or didn't? Rohit? Yeah. Yeah, so post-it notes being one that's good to expressly use. We actually have a number of those in our doc box that have some good learning points.
So about this whiteboard method, I usually use this method for teaching, but now since like last 6 months, I've been using medical students' iPad. So when I have like a group of small medical students in DE and I want to teach something quickly, I grab one of their iPads, start recording, and then write it down and do it there so that they have like to take it away as well. And they kind of, I've seen it like they like it more than paper and whiteboard.
What app do you use?
Keynote, I don't know, they have their own apps, like they show me,
Like
this
Notepad
is a
or
good
something?
app to go ahead with this.
Okay, like a
So it's
notepad.
something like notes or something?
I use like Notability and GoodNotes to take notes on my iPad, and you can record as you take the notes. So when you like go back and play it, you can see it drawn out in real time on Notability. And that has been phenomenal.
So virtual whiteboards as well. We've got a couple of votes from the back as well for that.
Exactly, notability is great.
Yeah.
Yeah, so I think that having those express methods, being deliberate about the way that you apply micro-teaching is, probably the biggest takeaway from this. A couple of us mentioned for these different methods that, if you tell a learner that you're using a method, if you expressly say, hey, this is learning, that helps to improve the learning. We have some clinicians that'll give us, key points, things where they just name the fact that what they're doing is teaching, and that helps to make things more memorable. I think it works the same way as you see your press gaming go up by a point when you ask a patient how comfortable they are and name all the things that they're going to be asked about when you discharge them once they get all their full body MRIs and extra lab testing that your learner ordered. Outside of that, I think that the other key things are going to be that it's going to be dependent on the learner, on the learning environment, and on a number of individual factors in each situation. There's not one of these that's the best one. If it was, this would be why 1 minute preceptor is the best, is the title of our talk. There are a few of these that are very learner driven, especially the 1 minute preceptor and snaps. You have to have an engaged learner. You have to have somebody that's going to answer those questions for you. And sometimes that's just not the right thing. Sometimes they did a great job in giving you a review of what the patient ate that day and why they're concerned about having swallowed the seed from a cherry. But what you're really concerned about is the patient's third-degree heart block and the isoprel drip that they were sent to you from, which was unfortunately a real case. So sometimes you need to have a more faculty-driven approach, like the post-it notes, the whiteboards. Sometimes you just have a learning point that's so great or a case that's so great that you want to share it with more than just the one learner. So being deliberate and applying the best method to the situation are really important ways to make micro-teaching work for you. Since we're around our time, I was going to open up to a couple of questions. Natalie?
Great job, great job. My question is more towards the fellows and attendings in the room. If you have any strategies that find that, especially in my shop with very minimal wording, and sometimes I'm seeing over 30 patients in an 8 to 10 hour shift, and I have a really hard time getting any teaching done. So I just want to hear if anybody has strategies for that.
Yeah, so the brief question is with high throughput without time, how do you make this work as far as time?
I would say, oh, go ahead, I'm sorry.
Oh, I was just going to say, kind of, even the thing we talked about with the Post-its, just get one little teaching point. I did the exam, salt pairs fracture classification, boom, done. Draw a quick picture of it and you're finished. Or pull up MD Calc and say, look, here's the pediatric appendicitis score. Here's the PCAR head injury score. Make sure you know sort of online where a bunch of important things are if you can't draw them easily, and then you can teach something in 30 seconds. And then if you have it on the screen, someone can look at it after you walk away.
Yeah, I think we can also use another term like underestimate the think aloud process, right? Like especially residents, they love you're an efficient emergency physician. There's not a lot of work with you, so like what's going on? So like even that your task switching, your prioritization, I think a lot of times we just do it, right? You say it out loud and say like, just follow me and listen to me for like, 10 minutes, right? And then they can get a sense of like, oh, what are you thinking? What you're prioritizing this stuff. Residents love that.
Yep. I've had that show up in my evaluations from students that they like hearing my thought process.
Yeah, so for anybody that's listening in virtually, our two answers for how to make these teaching points happen on a really busy shift is one, finding the things that you can teach quickly that are, like the back of your hand, like Salter-Harris fracture classification that you can draw out quickly. And then second, verbalizing your thinking process. Anything that you can be deliberate with, you can name what you're doing. Even outside of explicit learning points can be a great teaching method.
Yeah, and I would just add, I mentioned to a couple of the groups, our students rate faculty on time with attending. So if you're walking to a stroke alert or a trauma code, just grab the student. And you may not see this as a valuable discussion, so let's talk about the trauma. Here's what I know, here's what we're going to do. But on evaluations, I've routinely seen the attendings that spend some kind of time with the student as being the ones that have the best scores, really. And I think sometimes we don't think that's valuable. The example I gave, if I'm going to check a patient in hyperbarics, I'll bring the student with me and talk about our hyperbaric program. And it takes like 15 minutes, and I was going to do that anyway, right? So that really works, I think, pretty well as well. So yeah, go back to you for that.
Anybody else?
One of these bedside teaching, what I noticed is sometimes, that's a concern like anything tend to be friendly, and the medical students are scared to talk. I don't know whether this happens in your setup, but it's very common in our setup. How do you mitigate that, and how do you help these? I mean, those teachers are not very, I mean, they're not evil, but they struggle to not be non-friendly. So how do you mitigate that?
Yeah, so the question is, how can you mitigate when you may have learners who are unintentionally intimidated by clinicians that they're working with? I'll open that up to our panel.
Any thoughts?
I can throw out one thing, showing some interest in their life. I don't know, I feel like if somebody, when I was a resident, if somebody would ask me about how the year's going or ask me about something I'm interested in, then I'm less likely to feel intimidated.
Yeah, and having been
Yeah, and again, for our online folks, because that was, I think, a really great point. Just as important as the teaching method is the learning environment and doing what you can to model good behavior and being well, as well as to help encourage that in your learners, makes a better learning environment, makes better learning.
We probably have to wrap up, but it's like, we're coming in.
All right, so that's it. Thanks everybody for coming.